a foundational IT element, a comprehensive security strategy. I will introduce to you our moderator. He is Chuck Parker. He's the Executive Director of the Continua Health Alliance with over 20 years of experience in healthcare technology, policy, and the strategic design of evaluation and measurement strategies. He has led national programs for practice transformation and has served on national committees for assessing adoption requirements. So let's join Chuck.
All right, thanks. Thanks all for sticking around this late, and we certainly appreciate that. And hopefully we're going to make this a little bit entertaining for you. It's sort of a question and answer session here. I'm going to moderate a panel, and I'll ask some questions out. But I do want to let you know that you can ask questions as well. So as we go along, if you feel like you have a question, please raise your hand. Again, there'll be some microphones out there in the audience. But if you do have questions, feel free to stop us. We want to make this as interactive as possible, and so you take that opportunity to ask some questions. But I'd like to have the panelists introduce themselves and tell you a little bit more about themselves. So first we have Bree Jackson.
Good morning. My name is Bree Jackson. I'm the former CIO for CalHIPSO, one of the largest RECs that was formed. Earlier this year, I made a change to do a direct project with the state of California, talking about what's next for California, looking at the very different aspects of the REC program in a very specific space around the rural health. So the targeted scope of work that I'm managing now is around the state of California. What strategies will we roll out as it relates to everything related to HIT and HIE?
And next we have Deborah Kobza.
Hi, good morning. Deborah Kobza, I'm the Executive Director and CEO of the National Health Information Sharing and Analysis Center, or ISAC. For each of the nation's critical infrastructures, there's a private sector-led information sharing and analysis center that's responsible for security, threat, and vulnerability, intelligence, and information sharing, and helping with leading practice and education.
All right, so first question I have for the panelists here at this point is, what is the Presidential Executive Order and the Presidential Policy Directive for National Critical Infrastructure Protection? Do you want to go into that?
Okay, thank you. I don't know if everybody was able to see back in about the middle of February during the President's State of the Union address. He also released a presidential policy directive and an executive order on cybersecurity. And what both of those orders do is mandates the federal government and the agencies to work together to do a better job of protecting our national critical infrastructures, and directs the National Institute of Standards and Technology to develop a national cybersecurity framework for critical infrastructure protection. We're working directly with NIST and Donna Dodson, who is the cyber chief for NIST, and her team on this initiative. NIST is having several workshops around the country because this is an industry-led initiative. I haven't seen an opportunity like this with the federal government, I don't think ever, to where they are reaching out to industry to come to the table to define this cybersecurity framework. Because I don't know if you realize, over 90% of the nation's critical infrastructures are owned by the private sector. So NIST is having a series of 3 national workshops. The first one will be in the week before Memorial Day. If you go to the NIST.gov website and type in cybersecurity framework and search for it, you'll see it's at Carnegie Mellon in Pittsburgh. It's a 3-day workshop. It's not a presentation type of conference that you go to. This is where you'll be rolling up your sleeves to work on different categories of cybersecurity for critical infrastructure protection. The next workshop will be in mid-July in Florida, and then the third workshop we're working with NIST to have that in San Diego, California. So this is really an opportunity for everybody to participate, and highly encourage y'all to get engaged.
So Bree, what other things do you see where the health sector can have a voice in this, and other opportunities in the security roles?
I just want to take a plug with what Deborah was saying, is that if you are not planning to attend any of those workshops, there's probably a local agency or an agency in your state that is participating. So send as much of your questions and information to them. I think it's really easy to identify them. You may want to just contact NIST directly. I'm sure they know who has been on their webinars and may be able to point you in the right direction. I hate to volunteer Deborah, but she might
Well,
also.
that's our
Okay,
job.
Okay, and, to do that. I think the more we come together and define things and put our information in the hat, the more it will be considered. You know, we had this round robin earlier this year about what does a practice have to do to really comply for meaningful use. Well, I want to tell you, 2 years ago, it was a checklist. It was a checklist to do a security risk assessment. It was a checklist. Today, it's a very interactive, more than a checklist, identify what those vulnerabilities are, and we want to plan. So you see the shift has gone from 2 years ago when we talked about REC services in the incentive program, that it was a checklist. And today, it's not. So it does evolve, and you want to stay engaged as possible.
Sure. What are we seeing, what does the threat landscape look like today? What are you seeing out there in the market space from that perspective?
Want to go first on that? Okay, sure. You know, the tables we've all talked about. We've talked about, you know, the fact that there is the true criminally minded threat, and then there's the things we do unexpectedly by adopting technology, which we didn't talk about today, but for me it's a real thing. With the use of health information exchanges, I find a lot of what's happened in the past 2 years has been it's been an accident. You know, we were trying to do an interface, we're trying to connect a regional hospital with another clinic, and information gets dropped. I think the threat really is much. It reflects much of what your activity is. The more active you are around your patient data, the higher your threat will be around patient data. The more active you are around fulfilling initiatives such as HIE, the more the threat will reflect that. But I think for most of the CIOs in California that I work with in a regional kind of extension center format, and we're continuing that work now for the state, their threats are very local. Their threat is staffing. Their threat is people leaving the organization and not being made aware of it. Their threat is a lack of compliance or compliance-related efforts. It really does depend on the organization. And I think that the first place I ask CIOs to start is by telling me what you're working on, because that tells me where the most effort is. And we can marry what you're doing now with what you need to do to really meet compliance. It reduces the cost, because at the end of the day, from a CEO's perspective, he or she doesn't ask me about what I plan to do for privacy and security. They ask me, how much will that cost?
And being with the National Health ISAC and working with Department of Homeland Security and NSA and a lot of intelligence providers, the threats are increasing from the adversaries and the bad guys out there to get into the healthcare systems. There are a lot of daily alerts and advisories that we send out every day with actionable intelligence on malware or attacks on different ports. And that's where, in order to really protect ourselves from the threat landscape that's growing bigger for healthcare, because the bad guys are just realizing the value of targeting healthcare, that they've been targeting the financial sector for years. So it's going to get worse, so we've got to really work proactively together to share intelligence amongst ourselves so we can move from that reactive to a proactive stance.
Let me ask a question here. So what, and this is sort of a general question, what have you seen as the most successful attacks lately? What are you seeing that have succeeded in those sort of threats that have gotten through the wall, if you will?
Well, most recently, some of the threats that, even from the Boston tragedy, there were hundreds and thousands of fake websites out there and malware that was going out for fake donations. So that's getting through the wall. The same thing with Hurricane Sandy. There was a lot of, with those technology systems going down or data centers being flooded during that hurricane, when you're bringing up those technology systems, that's when they are most vulnerable for attack, because you're trying to bring things up so quickly that sometimes technology staff forget to implement or bypass a security protocol that they would have done normally. So those type of response activities are very important. And of course, you have the insider breaches, like we talked about during the risk management session. And you also have, attacks on infrastructures. We work with a lot of the largest pharmaceutical companies, and they're just attacked constantly all day long. So being able to protect your network and protect your infrastructure and protect yourself from the insider threats is really important. But it's those daily malware attacks, those, attacking IP addresses, that things that are doing to exploit, like OP Bad Pharma, those type of campaigns that are out there. There's an OP USA or OP America that's going to kick off in July. So there's a lot of work being done to hopefully thwart that effort, but you have to really stay on top of all of that.
I think I would just agree with Deborah. I think the things that are also getting through is fake patients, or patients are scammers pretending to be patients asking doctors for very specific information. And doctors think it's their patient's health record asking for information, and so they don't verify the sender. Not having a list of those commonly types of incidents, providers are left in shock to learn that what they responded to was not their patient. That's a big one for me.
Yeah. Do we have any questions out in the outside here in the audience? Anybody have any questions at this point? I'm going to keep asking you, so just be prepared. If not, I'd like to carry on a little bit further with that conversation about some of the security threats that we're seeing out there in the market space. And you mentioned, Deborah, that you actually have a clearinghouse that you can sign up for. So there are resources that can help us out here in this field, that you can get some of these daily or weekly alerts. What are some of those resources that are out there in the field at this point?
Okay. Well, the National Health ISAC, like all ISACs, is a nonprofit organization, and for each of the nation's critical infrastructures, there is a private sector-led ISAC that's formally recognized by their respective federal agency, like Treasury for finance, health for healthcare, EPA for water, et cetera. So there's one ISAC for each of the nation's critical infrastructures that are nonprofit and funded by their memberships. The only two ISACs that are funded by the federal government is the Emergency Management ISAC and the Multi-State ISAC for state, city, local government. Those are both supported by Department of Homeland Security. So what we do is work together as a community of trusted partners to, on a 24/7 basis, monitor not only cybersecurity, but physical security threats and vulnerabilities, because you have to look at things from an all hazards perspective. Something happened, in physical can impact cyber, cyber can impact physical, et cetera. So we send out daily alerts and advisories and bulletins that on every morning at 9 o'clock, we're on a call with Department of Homeland Security, the FBI, sometimes NSA, and all of the other ISACs to do sector and cross-sector analysis to determine, has something happened in the financial sector that's going to cascade into health? Or has something happened in health that's going to cascade into water or supply chain or manufacturing, all those different critical infrastructures? There's so you have access to all of that information and that intelligence. The other part is having a secure technology to share that information. So we partner with Lockheed Martin, which is the highest attacked organization on the face of the planet because they're the largest defense contractor. They built a secure portal for Department of Energy and the utility companies for them to share cyber intelligence information. So we've been very fortunate for Lockheed Martin to host a portal for the nation's health sector out of their cyber center in Gaithersburg, Maryland, to where not only sending out daily alerts and advisories and bulletins and reports about cybersecurity incidents, but also being able to securely share that information with hospitals, with health organizations, and for them to share information back to us. That's the only way we're going to move from a reactive to a proactive stance, is to share information together. And it doesn't mean sharing, IP information. It's just what are you seeing on your networks, so that we can investigate it, we can let other people in the health sector, other organizations know about it. So if it happens at one organization, organization A, organization B won't be affected. The other resource, and this is really an opportunity for everybody to participate. Yeah, if you just go to nhisac.org, it will tell you all about it.
And that's NHISAC. It's fairly straightforward.
Yeah, sorry, the southern slang kind of gets in the way sometimes. Also with the National Cybersecurity Framework that we're working on with NIST and DHS and all of the ISACs are a part of, we're right now in the process of implementing a national healthcare and public health cyber response system. And this is being coordinated on a state-by-state basis. And we've put in place a national cybersecurity council in every state that's consisting of not only public sector, but private sector stakeholders from all the different categories of the health sector. And what that response system is comprised of is not only how we share intelligence amongst each other, but also the response part, what you need to do within your own organization in the event of an incident, whether it's physical or cyber, how the response works within the health sector across other critical infrastructures and with government. Nationally, for all critical infrastructures, we don't do a good job right now of aligning physical emergency operations to cyber emergency operations. So we need to blend those together from an all hazards perspective. And the response system includes, for every health organization out there, identifying and annually training cyber first responders, as well as workforce education, cybersecurity education from a role-based perspective. So if you're a nurse in informatics, a CEO, a CIO, you have cybersecurity education that has meaning to you. You know, what is my responsibility for security and how is it going to impact me? So there's opportunities to participate in that initiative and to help define that. We'll have the first draft and everything done by the end of this year. So we would welcome to have all of y'all participate.
Bree, do you have any other comments on that on local?
No.
Just slightly switching that and carrying it a little bit forward, talking a little bit more about on the proactive side. Are there common places where we can go today for, as an organization, to download, like, for example, language we need to put in contracts? So we all know what HIPAA looks like. We know what the business associate agreement looks like. But I want to sign a contract with a provider, let's say it's an EHR vendor, that we want to now ensure that we have the right kind of language in there to help provide that security so that, you know, we know that that company is at least trying to do its best. Are we starting to see any places like that where we can go get information, sort of being on the proactive side?
Yes, I'll start first. I actually think that there are tons of individual auditors that are out there that have that contract language. I actually was talking to someone earlier. I don't necessarily think I endorse it completely just because every organization is different. What we're finding is when those policies have been written in California, at least, what we're finding, and in Arkansas, the organizational different departments that are impacted by that policy may not be as educated about what's in that policy or that contract as what that independent auditor who wrote the policy for you may have conveyed. So what we're asking is, and I think what we are asking most of our organizations to do, is to make sure that there's an educational component to all of your contracts with independent auditors or people that provide that service for you so that you can bring that information back down to the people on the ground who then need to operationalize it. Operations in healthcare is a big component of what we do. HR is where most of our compliance departments live, but without that direct connection, they're not able to maintain the policy, they're not able to maintain the contract. Therefore, it really does put them at a disadvantage to try to enforce the actual requirements within the contract. Deborah, do you agree?
Yes, absolutely. There's also resources available if you look at different health organizations and associations that are out there. One I mentioned during the risk exercise was the Department of Homeland Security. They have a whole department that's dedicated to outreach to help organizations with security leading practice, helping them with breach plans, response plans. Also, Department of Health and Human Services for For each of the critical infrastructures, there's what you call a sector coordinating council, and it's divided into two groups, one for government and one for the private sector. And the Health Sector Coordinating Council that I chair cybersecurity committee for, there's a lot of resources available there that we work on, different types of sample policies and templates and things like that that you can get access to. So, and that's part of our mission, of the ISAC's mission for all the critical infrastructures, is to help connect you with those types of resources.
Sure, thanks. So switching modes a little bit, and this is an area where I'm more interested in it as well, because I delve in the mobile side of this. So really it's what happens outside the typical four walls of your institution, and that is how do we start to look at data that's flowing directly to the end user, whether that be patients who are at a facility, maybe even our remote clinics as well, but more importantly now we're starting to see this move towards enabling individuals with technology at their home where they live today, where they live, work, and play. And so one of the things that we're looking at here is what does those policies look like from not only from a PHI perspective, but also from a security perspective. So what are you seeing in the market space today? What is some of the strategies that are focused on? Let's start first with that ePHI.
I'll talk about two strategies. The first strategy is one I've watched now progress for about 4 years. I don't know if you know Dignity Health, formerly Catholic Healthcare West, just rolled out their Mobile MD product. And what I've liked about it, and I think other organizations are looking at it, and we're going to take a deeper look at it in California sometime later, early part of May, for an HIE summit, is they've really taken this kind of token, which I didn't think was coming back, this token process to a completely different level where each user has so many tokens per month based on their ability to provide care. So if you are a provider, you start out with so many tokens per month, and they watch your usage. They want to start a baseline, which I've not seen that so active as a part of a mobile process. But what they've also built on top of it is what types of patients are you looking for? Are you looking for the patients you've seen in the past 30 days, or do you go back further? So there's history. So not only are you tokened, but you're profiled. So when you do something that's outside of your tokens, or you do something outside of your normal work from a platform perspective, the platform reports that anomaly to the technical department. So that's a very strong process that I've liked a lot. The other thing that I've liked a lot that a particular vendor has rolled out, really large, and I'm talking about it, but I don't know if I should be, so let me not say the name of the vendor, but it's a coded process where nothing is really as it seems. So if you get a message, the physicians are educated in a shorthand coding care dictionary. And we start out very, very small. And so you get messages, but they're not complete messages. And so if you get enough message that you can know if you need to go to your secure network location and log in, or if you can just, breathe easy at night because that issue is resolved. So it's a coded framework. So that coded framework, as I look at it and where it's being tested, the providers seem to like it more because it does answer the question of, did I get the information? The answer is yes. I then have a choice. I can live with that information, feel that I have enough information that I can take care of my patient, or if I need more information, I can go to a secure area on the network and see the patient record, but I have to log in. So I get a chance to make that decision, the provider gets a chance to make that decision. Those are the two pieces that I find most useful that seem to not only match the privacy and security goals, but it also matches the provider needing to have access to data in real time. Because at the end of the day, they're not adding their Yahoo or forwarding information to Yahoo just because they want to be non-compliant. They're doing it because they want information real time. They want access to data.
Sure. So on that, on the mobile strategies themselves, are we seeing a different sort of move towards that? The thing is that we're dealing with multiple OSs. So you've got the Android operating system, you've got iOS, you've got Windows, and then you now have perhaps even Blackberries now coming back into play here. What are you seeing as some of the strategies to use to either, are you saying we're only going with a single strategy, or are you looking at these token-based technologies being able to initiate any OS?
I don't think we're going for a single strategy. I think one of the bright things organizations are starting to think about is a HAP. Is a health application platform, so that you can educate your users, you can take their specific technology and build your systems around it. The HAPs are not they're not all named. Each organization's looking at it slightly different, but I find that they're all saying, we can't make everyone use, we don't, do you want to go out and buy iPads for everyone? Do you want to go out and, and buy iPhones for everyone? Maybe not. I mean, you want the user to use what they're most comfortable with. So they're looking at health application platforms as a way of answering the questions about single sign-on, but it's also about control. And it's not only about control, but it's making sure there's a continuity of care pathway identified per the technology. I see that moving very quickly. I think the other piece is that for those of us who are sitting on the sidelines, and this is my plug for those of you who have invested in your bearing the pains of doing something around the work we're talking about. Those of us who are on our way, our costs will decrease over time because we'll have the infrastructure in place. So when these policies are rolled out for mobile services, you've learned through your other work kind of what you need to do. For those of us who are sitting on the sidelines, it's painstakingly obvious that the more we improve the process, the more the vendors' costs are for the services. So while we're waiting, vendors are starting to charge more for things like secure messaging. Last year, I could have bought a secure messaging platform for $1 a user. I could have negotiated down to 25 cents a user, quite frankly, because they had no other clients. Today, they have 4 states, and that price has gone up to $6, which I think is just, of course, it comes with a loaded more bear of services, but I'm seeing the prices change as these platforms and technology matures. I think that, in closing, I find that each organization will have something that looks a lot like a HAP, because it does need to be adjusted. It will need to comply with all of the operating systems that are being used by their users.
Anything to add on that?
What I'd like to add to that, we've got access to so many incredible technologies that are out there, but unless we educate our users how to use them, and change is the hardest thing because they're used to doing things a certain way for years. And the best way that we found to do that is to make them part of the process. When you're putting in place your mobility and mobile management policies and procedures, ask your user, put together a user group and ask them some questions. Make them part of the process in defining what those procedures are. And that brick wall that's so thick for change will start to come down because they feel like they're part of putting something together that's going to help benefit them. But trying to get them past, bringing their own device or an institution having control to be able to wipe that device, or can you partition that off within my bring your own device? There's all types of questions that they have that need to be answered. So making them part of that process is important.
Just want to add on to that, one of the bright spots, and we call them bright spots, when we see something that works and it's innovative and it has an easy onboarding process, we call it a bright spot. One of the bright spots I've seen is that one of the organizations went as far as to say, bring your own device, and by the way, use our service. We have contracts with AT&T and with Verizon and all the top carriers. So they then get a feedback of all the systems that are, and they match it up with the user. So it's kind of that dual control piece. Bring your own device is more than just bring your own device. There's an administrative role for those of us who are in technology to control not just that device, but know what that device is. So when that device is lost, we're not trying to, really go back to a piece of paper or to something that was sent to us to find out exactly what the serial number is so that we can send out a message to instantly swipe the system. It's something that lives and breathes within the network. It's a contract that's controlled by the organization. It has organizational legs, and so therefore we can disconnect or we can modify at any time.
Sure. So with all these strategies that you're talking about so far, there's quite a bit of things that we have to take a look at here. It's obviously perhaps even a little bit scary for us all,
Yes.
To start to think about
Yes.
this. When you take a look at that, how do you prioritize? What are some of the things that you need to start as an organization when you look at these types of things we need to initiate? Because you're looking
Sure.
at, okay, I've got to take a look at my existing systems today and figure out how I'm going to implement that. I've got a training thing I've got to educate my staff on. I've got to create a strategy for the external components of this. Then not to mention the health information exchange aspect of it as well, and where that data is going to go. So where do you prioritize? How do you begin to take a look at implementing these types of technologies?
To quote the military, and having been in the service, the Army for a very long time, and being in healthcare now for 25 years, I don't think that there's a right answer to that question. I love the question, but we've heard other people ask the same question. Their answers are slightly different. I think each organization has to take a look at what are their strategic goals and keep in mind the various different areas of business that we manage, because technology is not about technology. Having been in the process where I've written a state plan to do HIE, the stakeholder group that I represent has everything from your doctors to your nurses, from your consumer. When we've not talked about the consumer views on our take on privacy and security, which is a completely different conversation. But I think that you look at your organizational goals, and I think that you also, and I think we're all doing it, but we also need to think ahead 5 years, because much of the work we're doing now, the funding that's available to us now, is not earmarked 5 years from now. That incentive dollar for provider will lose some of the motivations that we have to really get users to comply. So I'm asking many of the CIOs in the state of California, thank you for your 1-year plan, thank you for your 2-year plan. I know it's impossible, but tell me, what do you want to look like in 5 years? And so that helps to drive an immediate need to tackle certain things. One of the things that I think Dignity did well, and I'll keep using them because last year they did a great presentation here at Health Tech Council, and I took a lot from it. But what they've done very well is that every major organization that they supported knew what the strategic goals were. So as these initiatives were being rolled out, there was a baseline of support for privacy and security. There was a baseline support for going mobile. There was a baseline support for users being trained. It was a baseline support for privacy. So if you want to establish those baselines, you want to make sure that your users know what the strategic plan is for the organization. It's not just one more technical project we have to do. Now, for the end user, it's something very different. I want to share a brief story because I love stories. And one of the projects that we were doing, which was a very big project, we really couldn't understand why users weren't putting in certain patient demographic information. And so when we tried to do a master patient index, it was incomplete because we were missing data. And we learned that the users had shared a best practice, which is in the event you don't know the patient's middle name, if you space bar it, spacing as a character, you don't have to put the patient's middle name. Isn't that nice, right? So we had like 50,000 charts that had no middle name. Okay, well, that's fine if you live in Northern California, but if you go to LA where there's like 1,000 Jose Garcias, it's a real problem. And so and they all live within a 10-mile radius. I mean, it's just a really problem. Being Jamaican, I talk really fast the more I get excited, right? So I couldn't understand that. I mean, I'm never wrong, and why do I have 1,000 Jose Garcias? I learned very quickly that, and so I went to talk to them, and I said, I'm having difficulty, and they told me all of their shortcuts around our system. So although we put these very specific tools in place, they learned a shortcut for date of birth, middle initial. They had a shortcut for address, and they shared it. So it was like organizationally wide. And I think from a technology perspective, we can't fix those things, but what we can do is exactly what you're talking about. We can educate. So from a strategy perspective, it's not just what you will do, is what does your education look like to support your strategy that supports your technology? Because technology is not the end result. It is just a tool to get you there.
And looking at it from a little bit different perspective, from an external perspective, as you're building those systems and putting those plans and procedures and policies in place internally, being able to also, as part of those plans, to have a program in place that you can connect in to manage external threats, be aware and informed on the intelligence around physical and cybersecurity threats and vulnerabilities and what's going on out there on a daily basis, and especially what countermeasure solutions and incident response that you need to have availabilities for to implement. And it's all around actionable intelligence, that you get intelligence that's not just a regurgitation of the news, you know, off of CNN or off different news feeds, but it's giving you actionable intelligence that you can actually use inside your organization. There's an official cyber threat intelligence language that was just approved last week by the Department of Homeland Security called STIX. It's a structured threat information expression language. And the ISACs are adopting that language, so when we talk about cyber threats, The intelligence will be talking apples to apples. So when you look at the cyber observables, the threat actors, the incidents, the countermeasure solutions, the course of actions, we're all talking the same language, and to automate that. So if you have an internal incident response system, that intelligence can come in and be like at machine readable speed, which is really going to help us proactively protect all of these infrastructures that we're working so hard to implement, because it takes one skilled hacker to get in to bring everything down, and for something little to come in that you might not see for a couple of years that doesn't kick off until year 3, and then things to just cascade. So being able to protect from an external perspective, protecting what you're working so hard to build internally.
What was the name of that?
STIX, S-T-I-X, MITRE Corporation, worked with Department of Homeland Security and the ISACs, and there were working groups, for a couple of years now, I believe, on this expression language. And it's really going to go a long way to, to help us all share, not just within the health sector, but across all national critical infrastructures. When we're sharing cyber intelligence information, we're all categorizing it and sharing it the same way.
So, just a plug for Health Tech Council. I flew across country, as many of you did, to come to this meeting, and I was late because I had to work, as many of you have sacrificed. One of the things that I love about this particular setting, and I think more people are asking me to come next year, is that we're intimate. You don't have to, when I go to HIMSS, did we go to HIMSS this year? I lost like 15 pounds walking around. It was so huge, right? I can't say I learned anything. Did you learn anything?
No.
I can't say I learned anything. And it wasn't because I wasn't trying, but I find it so massive that one of the things we have to do as we look at this body of work, at the end of the day, the provider needs to understand, the physician really needs to understand. Cybersecurity, great, it's out here, but the data they're after is his data. And so what we're trying to really do on a regional effort, and plug for Health Tech Council, is to try to put things together so people can get at all of this information in a centralized place. As it stands right now, my CMIOs are complaining that they spend 4 to 5 hours a night looking for the right information, and even then they're not sure it's the right and relevant piece of information that they need.
Sure. All right, one last time for questions. All right, not hearing any. One last closing question I want to put out there for you, and this is sort of a big question at this point, and that is really, as we begin to move towards things like cloud computing services, and really what ultimately leads to information flowing across state lines, where we have multi-jurisdictional boundaries. Are we seeing some changes in that area so that you now have some standardized language, so that you have the ability to manage a process or be able to put something in the cloud in that case? Because usually your cloud-based services aren't always located where your hospital is.
Many of the cloud service providers have a standard contract, and those of us who are trying to be progressive, we also have cyber insurance. So we're marrying those two contracts together with what we want to consider to be a professional services agreement. We're also working with lawyers in that specialize in this area in the state of California. And last I checked, it was a 212-page document. Set of recommendations. I think that every cloud service provider is slightly different. I think that your personal relationships, there was the day as technologist being Bree, we're sold this wonderful sales pitch as we're looking for different vendors. But I think those days are over. And now we actually come into the room with a set of measurements and we start there. And I think that's where cloud is going. I think that if you're not doing that, that's something you should strongly consider and reach out to other people that have done it. Because the hardest thing to do, recently, I can't say the organization, has a cloud-based service provider, and they realize that, there's payments involved, and when those things aren't paid, it limits your access. We don't pay attention to those things. But one of the things that limited in this particular project was our ability to go back more than 5 years. And I thought that to be very interesting, and because we didn't buy that service. And so, but we didn't know about the service when we did the contract. So it was just a very interesting, I say we, because I always think of project teams as assuming the role of the organization. I think this is one of those times where you search and you look for the best solutions. There's certain cloud service providers that are leaders, and there's others that are entering the market. And I think like everything else, you pick the service provider that best reflects the goals of your organization. And not the one that is at the top of the list, because at the top of the list may come with a huge price. So you do look at the service provider that reflects the goals of your organization and make a decision, make that your starting point for a decision.
One of the initiatives that NHISAC has taken on, an initiative we were asked to do by a number of healthcare and hospital organizations across the country, is put together a community or a healthcare sanctioned standard for technology providers, security providers, cloud computing providers. We were getting a lot of questions and angst around, as an individual healthcare organization or hospital, it's very hard for me to hold a vendor's feet to the fire on certain standards that we may want them to adhere to. But if we could put together a standard collectively for the health sector that says, you know, Mr. Vendor, Mr. Cloud Computing Vendor, by September 2016, you need to adhere to these set of standards or we're not going to buy from you. That brings the collective community together for the health sector to really have a defining voice in what they need from the vendors, instead of really trying to do that on an individual basis. So when you're looking at cloud computing, that's huge, because in the health sector, and coming from a pharma medical device background, validating computer systems, you know, FDA regulations and everything that comes along with that, how do you validate cloud computing? So there's a lot of things that need to be done there. So that's something that we're working on and would welcome your participation.
This is going to have to be the last question. Hold on.
It's not a question. I think in the cloud computing industry, there is, recently, I'm sure you're aware of it, the Cloud Security Alliance, which is a standards body that is put together to promulgate, issue good practices and standards. And I think there is work with the healthcare community for sure. And so I think that's a resource that people should be aware of. You can go to this particular group and look at what they put out, and they do describe different standards and also good practices. Just wanted to mention it.
No, you're absolutely right, because it's not about reinventing the wheel. It's about connecting the dots. There's a lot of great work like that that's already out there that we can leverage. It's just connecting the dots and bringing it together, and how does that apply to the health sector? So very, very appreciate that. Thank you.
Great. Thank you so much.
All right, I want to say thank you very much to
Yeah.
Bree and to Deborah for the conversation today, and thank you very much for the information.